This is Columbus Concerns, a public affairs presentation of North American Broadcasting. Here's your host, Mark News.
And thanks so much for joining us this morning. Of course, everyone is talking about COVID-19 or the coronavirus. Now, we still haven't had any cases reported here in Ohio, no confirmed cases as of today. However, we have had confirmed cases as close as Kentucky and Indiana, as the virus continues to spread across the U.S. Well, this week, Dr. Amy Acton, the head of the Ohio Department of Health, was a guest on our Loper and Randy morning show on 99.7 The Blitz here in Columbus, and she gave some good advice on COVID-19.
Dr. Acton, thanks so much for spending some time here on the show with us and taking a second. How you doing this morning?
Absolutely. Good. It's good to be here this morning. Thank you.
As someone who's really into fitness and health and wellness, I was a little bit, obviously it was a gut blow yesterday as we saw you and Mike DeWine talking about the spectator aspect of the Arnold being canceled. What exactly went into that and the thought behind it?
Well, I can tell you, that was a very big decision, one that took a lot of thought, and I have to really commend, first of all, the governor, the mayor, and the organizers. And as you saw, Arnold Schwarzenegger himself spoke. Yeah. This is a hard decision, but as you know, they're taking a preventive measure. It is an unusual and unique situation. That many athletes from over 80 countries. There are over 22,000 athletes, 250,000 spectators. So, it is something that the CDC came out with new guidance, and it has to do with, the local capacity to put preventive measures in place. And I can tell you, Columbus Public Health is one of the best health departments in this country, and they feel they can do a very, very good job protecting the athletes. But this is a preventive measure to stop the spread of disease.
Now, talking about the spread of the disease, are there anticipations of any other events that are coming up in the near future that will be canceled, that are large gatherings, like games, Blue Jackets games, perhaps the Crew?
Yeah, I think at this point, I think we're going to see evolving cancellations like this. You're seeing it around the world. You're seeing a shift to, just athletes without spectators, large conferences, businesses not sending their workers. And again, this is something that can help slow us passing this very catchy infectious disease to each other. And I suspect we'll see more of it. At this point, something like a 2-hour your kid's basketball game or something like that is still something where you can take precautions, wash your hands, avoid being very close to someone who's coughing or sneezing. But when you're talking something so big as the Arnold, where people are there for days in very close quarters, that's different. But I think you'll see this evolving thoughtfulness as we see community spread here soon. I'm sure we'll see it in Ohio as we're seeing it around the country.
So in New York City, they are already disinfecting the public transit. Are we going to be doing things like that with the COTA buses and stuff like that?
Yes, absolutely. There's so much that goes on behind the scenes and has been going on for weeks. And we work with businesses and hospitals and schools, giving them tips on how to get ready, how to do these cleanings. I want to say to people at home, regular cleaners work. So they can be doing that as well.
Okay. And so let's just go through it step by step. So if people are listening to this for the first time, how is the best way that people here in Columbus, Ohioans, can protect ourselves against the COVID-19 virus?
I want folks to take it seriously, but not be afraid. This virus is a lot like the flu, and I don't think people take the flu as seriously as they should, and we actually have a vaccine for that, and people should get that vaccine if they haven't yet. But it is like a bad flu. It's very infectious. People who are elderly, immunocompromised, healthcare workers are a little more susceptible to it than the average person. It looks a lot like fever, coughing, potentially difficulty breathing. But for most people will get it, stay home if you're sick, and they'll get through it. Some folks, though, will need to be hospitalized. What you can do, recommendations I would make right now are, stock up in case you have to stay home from work on some food for about 2 weeks. Have your medicines, a supply of your regular medicines for 30 days. Think of things like cold medicines and things. So if you're staying home, you don't have to go out to the drugstore and potentially expose more people. Think about your elderly parents. Think about neighbors who are alone and don't have help. As much as people are afraid, this is a time we can also help each other, and that is a message I really want to get out there. We have more tips on our website, coronavirus.ohio.gov. Washing your hands, as boring as that sounds, can stop the spread by 50%.
Wow.
It's something all of us should
That's
be doing.
awesome. Yeah, that's
So
really good to know.
I know it's boring. The coughing in your sleeve, the things we're saying actually work. They're proven to work. So, and then just keeping some distance if somebody is coughing or sneezing around you. But we have lots of tips on how you can prepare. But mostly, how can we help each other? Because a lot of people will be missing work. You'll be told to stay at home and rest potentially if you have the disease for up to 14 days. At this point, I'm dreaming of a quarantine with Netflix, but so it's we try to see the positive side of these things, but that's what it will look like. For most people, it will be a flu, but the flu is deadly. 35,000 people died in this country last year from the flu. And we've had a third a child die in Ohio from the flu. So it is flu and cold season. All of these things work on all of these diseases.
So I'm kind of nervous because all the reports I'm reading, it attacks the lungs. That's what it wants. It wants to attack the lungs.
Yes.
And so
yes, it is.
And the flu doesn't necessarily do that, right?
It does. The flu actually, a lot of times when folks are hospitalized, will be for things like pneumonia. So it does go to the lungs, and difficulty breathing is the sign to look for when, that will be a sign that your disease is worsening, and you should definitely be talking to your healthcare provider.
Oh, my God. I have asthma, so it gives me anxiety. I'm like, I don't want to catch it all because I already have, terrible lungs.
Right. And so, definitely talk to your healthcare provider on that. Do all these preventive measures. It really will help. And again, the flu could do this to you too. If you haven't had a vaccine, go get that, because again, the hardest thing about this new disease is it will be a while before we have a vaccine, and we're not immune to it. So again, I want people to take the right precautions, coronavirus.ohio.gov, and then, but those things will help, and your doctor and your provider will be there with you to walk through it, as are our local health departments. They're great resources of information.
All right, on the phone
with lots of tips.
I'm so sorry.
Go ahead.
You. Yeah, I just was going to let people know that Amy Acton is on the phone with us right now, the director of the Ohio Department of Health.
So I wake up this morning and we have one strain of coronavirus, and now I'm reading reports that there are two strains of coronavirus, and they're spreading around the world. 70% of infected patients have caught the more aggressive and contagious type. And so maybe that's why other people were getting it again. Remember, Kelly, we were reading reports that once they had the coronavirus and it was all said and done, they caught it again a week later.
Are both the strains here in the United States?
So there's a whole family of coronaviruses. Some of them cause the common cold, and I think that's where that misunderstanding could be coming from.
Uh-huh.
There's a type of coronavirus that is a common cold. This new type, the beta class, is the zoonotic disease, meaning that leapt from animal to human, and that's what happened in China. That happens occasionally with viruses. We probably give them to our pets, too. No one talks about that. But this virus is a particular strain that, again, is particularly infectious and does have, a fatality rate of up to 3%.
Wow.
Again, our knowledge of it is evolving daily. So, that's why I know it's confusing to people. That adds to fear because we learn a little bit more every day. That's why it's so important to go to good, trusted sources of information. I think that people probably aren't being reinfected with it. Actually, I think sometimes like a testing or a swab not being done right, or it's not. There's more to that. So I think we'll learn more about that. I'm thinking people had it all along, not being reinfected.
In your opinion, how far out is some sort of vaccine?
Well, I know it feels slow, but it's actually with each one of these spreads of viruses that we go through like this, these outbreaks, things get faster and faster. It's practically a miracle that they are going to be in testing in less than 3 months. That's how fast science is evolving on this. The fact that we can even test for it, we'll soon be testing here in Ohio, that is a miracle. But the actual vaccine is about a year to a year and a half away. There is some hope. There are some antivirals, sort of like Tamiflu is if you already have the flu. There are some that are already on the market that are being tested against this virus. We'll know in about 40, 45 days if it's effective, and that would be a great boon to us in this fight against this virus.
And there's the latest on COVID-19 from the head of the Department of Health, Dr. Amy Acton, who appeared this morning on our 99.7 The Blitz radio station here in Columbus. Coming up, COVID-19 affecting lots of things, including gasoline prices. That's next this morning on Columbus Concerns. Stay with us.
A health threat anywhere is a health threat everywhere. I'm Dr. Phil. A new coronavirus outbreak called COVID-19 started in China and is spreading to many countries, including the U.S. It's critical to get the facts about how to protect our friends and loved ones. While CDC is working with states and communities to stop the spread of the virus, health workers and emergency response efforts need our support. The CDC Foundation, a nonprofit organization, is focusing on immediate and critical needs that help protect our communities here at home and those around the world. We can all play a role in stopping this deadly virus. Get updates, learn how to protect your friends and family, and find out how to help. Go to cdcfoundation.org. That's cdcfoundation.org. Together, our impact is greater.
This has been a public service announcement brought to you by the CDC Foundation.
I'm Andrew Saul, Commissioner of Social Security. Beware of telephone scammers pretending to be government employees. Real Social Security employees will never threaten you. Callers threatening you with arrest or other legal action and demanding money are not from us. If you receive a call like this, hang up, do not provide them with any form of payment or information. Report the call at oig.ssa.gov.
And I'm Mark Neuse. Welcome back to Columbus Concerns, a public affairs presentation of North American Broadcasting. Well, the COVID-19 virus is affecting the economy, as we've seen on Wall Street this week. It's also affecting the price at the pump. Kimberly Schwind, our friend from AAA, is here to tell us a little bit about gasoline prices.
Motorists have probably noticed gas prices falling around the state. This is mainly tied to the coronavirus and fears that the coronavirus will continue to reduce global economic growth and global demand for crude oil. Ohio's average today is $2.24 a gallon. A week ago, it was at $2.40 a gallon. So we've seen gas prices across Ohio fall by 16 cents in 1 week. Many stations across the state are now sitting below $2 a gallon. Nationally, we're seeing an average today of $2.42 a gallon. A year ago, it was at $2.43, so only 1 cent different. But the price has fallen nationally on average about 5 cents in the past week. So we are seeing prices falling across the country. This is largely tied to demand destruction and fears of further demand destruction caused by the coronavirus. Last week, crude oil futures lost more than 16%, according to OPIS. This is the largest decline in more than 11 years. Last week ended with crude oil prices at their lowest levels since December of 2018. Since gas prices are largely tied to the crude oil prices, we've also been seeing prices falling at the pump. While markets and crude oil prices have advanced slightly in the last couple of days, it's really difficult to say if they're going to continue to advance or fall back again. Some of the recent optimism in the market has really been tied to the fact that OPEC and its allies are going to be meeting later this week, and there's been talk of cutting crude oil production globally to help to rebalance the market and raise the crude oil prices. So taking some of that excess crude out of the market to help to raise the prices. In addition, there's been notes that central banks have suggested that they're going to help countries dealing with the economic impact of COVID-19. So this has also helped to give the market a little bit of optimism and see a little bit of an increase this week. It's very difficult to tell how long this is going to continue or if it's going to continue. We'll know more later this week when OPEC and its allies meet. Another factor to consider is that we are just a couple weeks away from the spring refinery maintenance season. So in the middle of March, we typically will see refineries change over from the winter blend of gasoline to the summer blend of gasoline, which is a little bit more expensive to make. During that time, refineries will often undergo spring maintenance, which can cause some refineries to be offline or possibly have some issues when they're starting back up. A lot of times we will see price spikes related to the changeover from the winter blend of gasoline to the summer blend of gasoline, and also that refinery maintenance. In addition, as we get closer to the summer driving season, we typically see prices hitting their highest points of the year in May or June, just as we enter into the peak of the summer driving season. So it's going to be very interesting to see whether that happens or not this year, because the coronavirus is really driving the global economy and the gas prices right now. So it's all going to depend on how it plays out and how long it continues to impact the global economy.
And that's the latest on gasoline prices from Kimberly Schwind from AAA Ohio, as she talks about the lower prices because of the coronavirus. Most of the deaths that have occurred in the U.S. have been centered at a nursing home in the Seattle area. Correspondent Trace Gallagher tells us about some new action that they're taking in King County, Washington.
Seattle's King County is trying a novel approach by purchasing an Econo Lodge and several trailers to house coronavirus patients, which is not going over well with neighbors.
This is right across the street. This is close to home. So, yes, I have a concern about it.
There are also heart-rending quarantine stories like the viral picture of the elderly couple married for 60 years now separated because of quarantine, or the Alabama church members who went to Israel to visit the holy sites and unfortunately stayed in a Bethlehem hotel where a previous guest tested positive for coronavirus.
And President Trump went to the CDC on Friday. More from Jessica Rosenthal.
When President Trump went to the CDC Friday, he and officials were peppered with questions, including why testing for COVID-19 has been so slow.
Shortly after we distributed the first batch of our tests to some of the state health labs, that there was an issue with one component of the test. And so we quickly put together a team to try to figure out what that issue was, and we suggested that people not test until we could sort that out.
CDC Dr. Stephen Monroe said they test for 3 signatures and identified that 2 of those were sufficient for a positive test. Health and Human Services Secretary Alex Azar said local labs were being validated to have their own testing, so by the end of next week, he said the U.S. should have 4 million tests available. Jessica Rosenthal, Fox News.
And that's the latest this morning on Columbus Concerns, and we thank you very much for joining us. I'm Mark News.
Thanks for listening to Columbus Concerns, a public affairs presentation of North American Broadcasting. You can send questions or comments about today's show to Columbus Concerns in care of this station, 1458 Dublin Road, Columbus 43215. Or email us at columbusconcerns@napcomedia.com.
I'm Andrew Saul, Commissioner of Social Security. I'm here to warn you about telephone scammers pretending to be government employees. Some of these scammers may say threatening things like you will be arrested if you don't make payments or provide personal information. Do not fall for these tricks. These calls are not from us. Real Social Security employees will never threaten you for information or money. If you receive a call like this, hang up. Never give the caller your personal information, like your Social Security number or bank account, or send money in any form, cash, gift cards, wire transfers, or prepaid debit cards. Report the call to our law enforcement arm, the Office of the Inspector General, at oig.ssa.gov. Share this information with your friends and family.
Has your child swallowed your medicine, your laundry detergent, your nail polish remover? Call the Poison Helpline. Have you inhaled paint thinner, glue, pesticides? Call the Poison Helpline. Have a question about a dose, a fume, something your kid just drank? Call the Poison Helpline. Poisonings can happen at the home, on the job, or in the great outdoors. Call the Poison Helpline first for fast, free advice from medical professionals. Call 1-800-222-1222 anytime, anywhere. 1-800-222-1222. Save the number, save a life. Brought to you by the U.S. Department of Health and Human Services.